Okay, let's try this again. Starting at slide 25, I promise you no chickens or daughters were harmed in that little break. Okay, so the histology of the testes. Again, we have connective tissue capsules around the tubules. We have areolar tissue, so we're going to have macrophages, we're going to have collagen fibers, elastin fibers. Inside the areolar tissues, we're going to have blood vessels, and we're going to have some very important cells. They are called the interstitial endocrine cells. Older books may call them the Leydig cells. These are the ones that produce the androgens and primarily testosterone. So testosterone is required in order to get sperm to mature, and it increases the production and the maturation of the sperm. So here is a photomicrograph of a cross-section through the seminiferous tubules. So here is the tubule, the circle. You can see these little darker purple structures in here are actually developing sperm. And then we can see late spermatids over here. We can see early spermatids. And then in between the tubules, you will see the interstitial cells, like in here and in here. Okay, they did not label those Leydig cells. Here we go. So here are the interstitial cells up here at the corners. Okay, and then these are the spermatogonia cells. You're going to see those. And then we're going to learn about nurse cells as well that are interspersed among the spermatogonia. So when we go through the early stages of developing the sperm are immobile. They cannot fertilize an oocyte. So we have to allow them to mature. We have to change them structurally. We have to give them some extra tools. So there are other parts of the male reproductive system that are going to functionally mature them, nourish them, store them, and transport them. So if you take immobile sperm from testes, well, how do they get to these other structures? We're actually tapping them along with cilia. And the cilia will sweep them along and get them up into the efferent ductules and then into the epididymis. So the next structure after the testes is the epididymis. It's also a coiled tube. This time it's almost 7 meters long, and it's coiled up in a region that's about 1.5 inches. And it's on the posterior border of each testis. And within the epididymis, we have a region identified as the head, as the body, and as the tail. The head's the biggest part, and it's the earliest part. It receives the sperm directly from the testes. The body runs along the back of the testes, and then the tail is where it goes down to the bottom of the testis and begins to turn upwards and become the ductus deferens. And this is where we're going to store most of the sperm after it's produced. So again, here's the testes. You can see the lobules, the seminiferous tubules, the rete testis, the efferent ductules, and then we get into the head of the epididymis. So the epididymis here is this backward C shape. All of this. So here's the head. Here is the body, and then down here is the tail. Okay? And then this coiled tube widens and becomes what we're going to call the ductus deferens or vas deferens. Why do I keep saying vas deferens? Because you guys may be familiar with a surgery that makes a male supposedly not be able to deliver his sperm into the vagina of a female, right? And in surgery, ectomy means to cut or remove. And what do we call that surgery? A vasectomy, because of the older name of this tube, the vas deferens. So what they do is they come in and they cut the tube across so that the sperm that are developed here don't make it through the rest of the ductus deferens and out through the front of the penis to fertilize the egg in the female. So here are those little cilia that are going to be tapping the sperm cells along because they're not old enough and mature enough to swim. And we can see the tails of sperm here. And again, here's another view of the epididymis. Now, up here, the vas deferens or ductus deferens is joined by all the other things that we saw, the veins and the arteries and the nerves and lymphatic vessels. And so this whole structure right here, all of it wrapped up in the connective tissue lining, is the spermatic cord. Okay, so job of the epididymis is going to be looking at the fluid that's produced within the seminiferous tubules. It's going to take any damaged sperm and break them down and recycle them. It's going to store the sperm, it's going to protect the sperm, and it's going to help them get ready to be able to fertilize. So they've got some more steps that we need to take. And then comes the vas or ductus deferens. It begins at the bottom of the epididymis. It goes up through the spermatic cord, in through the inguinal canal, over the top of the male bladder, and then at the back of the bladder, it hooks around. It uses the ureter as kind of a holder, and then it will go down the back of the bladder, and it will go into the, will be joined by the secretions of the seminal vesicle. Okay? So it goes from the tail of the epidermis along the top of the urinary bladder towards the seminal and prostate gland. At the very end of it, it enlarges into what we call the ampulla of the ductus deferens, and it has a layer of smooth muscle. So smooth muscle, you know, is going to be able to propel the ejaculate during climax. It also is lined by pseudostratified ciliated columnar. It can perform peristaltic contractions to move the sperm and fluids that are being added to the sperm along. And we can also store sperm in the ductus for several months. We just kind of put them in a kind of a suspended state so that they're not using a whole lot of our materials for energy. Okay, so here's the thick, smooth muscle wall in the ductus deferens. Here's the relatively small lumen of the tube. And you can see those pseudostratified ciliated columnar in there. And the sperm would be in the middle. So, the urethra is the same tube. We're going to take the two vas deferens. They're going to merge. They're going to come together at the level of the prostate. Okay? And then that is going to be the name of the tube from the prostate all the way through the tip of the penis is the urethra. So the urethra has three sections. The prostatic urethra, which of course is running through the middle of the prostate gland. The membranous urethra, where it passes through the wall of the perineum. And then the spongy urethra that goes into the base of the penis and then all the way to the tip of the penis. Now, along this, we're going to have the accessory glands, and their job is to give us the composition of semen. Now, things that are going into semen, we're going to have some food for the sperm to provide them with energy. We're going to have some pH buffering agents because actually the vagina is an acidic environment and we need to neutralize the acid so it doesn't damage the sperm. We're going to use it for lubrication, and we're going to have several other components to this semen that we'll talk about as we get to each gland. So the three kinds of glands that are going to contribute to semen are the seminal glands, the prostate gland, and the bulbourethral glands. So here's a posterior view of the bladder. So here's the back of the male bladder. Here's where the ureters are coming down, one from each kidney. And so the vas deferens has come up from each testis, and it goes over the top of the bladder, and it uses the ureter as kind of a holder, a hook. Okay, so we have them too. Then it widens. This is the ampulla of the ductus deferens. And then you see we have four things that come together right here. This is the ductus deferens. This is a seminal gland. So I have that mirrored on both sides. Okay, so it gets wider, and then we have the seminal gland has an excretory duct. And then once these two merge in here, right above at the top of the prostate gland, we are now going to call this the ejaculatory duct. So we have the secretion from the seminal gland plus the sperm coming up the ductus deferens. They are now in the ejaculatory duct. And then the ejaculatory duct gives way, and now we're going to call it the prostatic urethra. And this is the prostate gland that is surrounding it. Okay, so prostatic urethra happens from the end of the ejaculatory duct to the membrane here, to the exit of the prostate gland. And then I have the muscle here that's at the floor of the pelvic floor. And we're going to send the urethra through that. That is going to be the membranous urethra. And embedded in that muscular floor are our bulbourethral glands. And then when it exits from there all the way to the end of the penis, it will be in the spongy urethra. So the accessory glands, again, they're going to activate the sperm and mature it. They're going to give it nutrients. They're going to give it lubrication and fluid to help it move along. And it's going to produce buffers, because both the urethral tract and the vaginal environments are acidic. So starting with the seminal glands, older books might call them seminal vesicles. There are two of them, one for each ductus deferens, or one for each side, and they are very active, and they are what are actually going to give us the most of the volume of what we call semen. Okay, so here's a cross section through a seminal gland. Again, once the seminal gland ejaculatory duct joins the enlarged ampulla of the ductus deferens, that's what we're going to call the ejaculatory duct. Sorry, excretory duct and ejaculatory duct. This one's only 2 centimeters, and then it goes into the prostatic urethra. Now the prostate, you have 1 prostate gland per man, and it is going to wrap around the urethra, and it's surrounded by smooth muscle fibers. It produces a slightly acidic fluid that's only about 25% of the semen volume, and it's ejected into the urethra by contractions of the prostate wall. If you've ever heard of the condition prostatitis, that's inflammation of this particular gland. It can occur at any age, but it most commonly afflicts older men. And you guys have all heard of the dreaded 1-glove test, 1-finger test for males. The easiest way to tell if a prostate is inflamed is to feel it, to palpate it by inserting the finger through the anus and through the rectum and feeling the prostate up against the rectal wall. So here's a cross-section of the prostate gland. Tiny little glands that are embedded in the muscle of the floor of the pelvic wall are the bulbourethral glands. Older books will call these Cowper's glands. Now, they make an opaque white alkaline mucus, which is why they're called Cowper's. It's kind of, Cowper discovered them, but there's also kind of associated with a milkiness. Helps neutralize the acids in the urethra, and this also provides lubrication. So each gland of the Cowper gland travels alongside the spongy urethra, and then it empties into the urethral lumen. So there's a cross-section through a bulbourethral gland. So, putting all of this together, semen, the ejaculate that happens during a male climax, is usually 2 to 5 milliliters in volume. If it's any lower than that, it could be a problem with either the prostate gland or the seminal gland. And within that 2 to 5 milliliters per mil, we would expect to see 20 to 100 million sperm. Now, this is if they went 36 hours or a whole day and a half since their last orgasm. That is the normal amount of sperm we would expect to see. If you know anybody who's ever had to go get a sperm analysis done, yeah, they make you refrain from sex for a couple of days, and then they'll have you come in and give a sample. So seminal fluid overall is about the same osmotic concentration as blood, but it has different things in it. So it has a lot of fructose. This is a sugar, and this is to give the sperm something to metabolize to move the flagella and propel them up through the female tract. There are also prostaglandins in seminal fluid. So a male ejaculate causes the female body to have smooth muscle contractions along the vaginal wall. That will help propel the sperm towards the egg, which is hopefully waiting in the fallopian tube. It also has fibrinogen, which, if you remember, was a blood clotting factor. Well, it clots the semen in the vagina. So it kind of holds it and gives it time to break down slowly so that we can release the semen and the sperm into the mouth of the uterus, the opening of the cervix, over time, and it doesn't let it just fall out of the vagina should the woman stand up. And again, overall, the secretion of the seminal glands are alkaline to neutralize acids. So the semen has sperm, seminal fluid, and these enzymes: a protease, seminal plasmin, prostatic enzyme, and fibrinolysin. So not only does it have the fibrinogen, it also has the enzyme that's going to break down the clot. Okay, so we've gone through all of the tube section, and now we are in the spongy urethra, and we enter the external genitalia, the penis. It's a tubular organ, and the spongy urethra will go all the way through from one side of the penis to the other, and it conducts both urine and ejaculate to the exterior of the male's body. So the penis has a root, a body, and a glans. The root of the penis is the part that attaches it to the body wall, and it's just below the pubic symphysis. The body of the penis is sometimes called the shaft of the penis, and it's the movable portion. And then the glans or head of the penis is at the end, and it surrounds the opening from the urethra. So, in front of the scrotum, so this is the root of the penis here. Here is the shaft of the penis. Here is the head of the penis. And running right through the center would be the spongy urethra that is going to carry both urine from the bladder and it will carry ejaculate. The skin of the penis has a smooth muscle layer, which is a continuation of the dartos muscle. It also has a very big areolar tissue layer that allows that skin to move back and forth. And it has a subcutaneous layer where we have arteries, veins, and lymphatic vessels. On the front, on the head of the penis, the glands, there is a foreskin, also called the prepuce, and it will attach to the neck and goes over the glands. And within it, there are preputial glands, and they secrete a waxy material called smegma. Now, this is the main reason why in America, people who are not of Jewish heritage will still choose to circumcise their male children. They want to remove this foreskin so that we don't end up with this bacteria supporting material. That's one reason that's given. Of course, religious purposes is another reason it's given. A third reason for choosing circumcision in our country is, well, his dad is circumcised and I want him to look like his dad. And so it kind of becomes traditional for people who are doing it for any other reason besides bacteria and religion. It's just like, well, I just want my son to look like his dad. So it's a surgical removal of the foreskin, the prepuce, and it can help prevent infections and prevent penile cancer. Now, inside the penis, around the urethra, we're going to have erectile tissue. Now, erectile tissue is a little different. It's not a muscle. It is a cavernous network of tissue that can be filled with blood. So normally it is not filled with blood, and so that is a flaccid or soft tissue. But if we open up certain blood vessels and allow this tissue to get filled with blood, it gets turgid with blood. It gets hard, it gets stiff. So there are going to be 3 different tubes of erectile tissue that are within the penis. There are 2 at the top and 1 at the bottom. In the resting state, we constrict the arterial branches that would send blood flow into these tissues, and the muscular partitions are tense, so we restrict having any blood. During erection, we allow the arterial branches to be opened up, and we fill that part of the spongy tissue with blood, and it makes the penis stiffen and elevate. So, there are 2 at the top. Now, corpus and cavernosus or cavernosum, corpus and cavernosum would be the singular of those 2 Latin words, but because there's 2, they're referred to as the corpora cavernosa. So we go from US and UM to A's. So these are the 2 matching cylindrical masses of tissue. They are under the anterior surface of the penis, and they are separated by a thin line. And they have a really thick collagen lining. At their base, they split, and that forms the crus of the penis. And then each of those crus is bound to the ischium and the pubis by really, really tough ligaments. So these are going to go over what we would say in an erect penis is the top side. On the bottom side of the penis is a looser spongy tissue. It's, called the corpus spongiosum. The spongy urethra runs through the center of it. It is also surrounded by a sheath, but it is stretchier. It's more elastic than the hard collagen walls of the corpora cavernosa. What does this mean? That means that when the entire penis, all 3 chambers fill with blood, the 2 on the top surface fill up and get stiffer and are less giving. The one on the bottom surface is a little softer, which causes the penis to have a slightly curve upward. And when it's in